Good evening, everyone. It's Dr. Shiva. So this is glucosamine, and we're going to talk about joint health, and we're going to take a molecular systems biology approach using Cytosolve, the technology that I created for my PhD work out of MIT, and which we've been working on for 16 years. Cytosolve is a technology. It's a revolutionary technology that allows us to use the computer to eliminate the need for animal testing so we can model complex biological phenomenon using the computer. And I'll talk more about that, but we use Cytosolve now as a public service. We've used it to make money, where we help companies who are trying to figure out what products to create, does it work or not. And our goal is we don't need animal testing. And I have a couple dogs. In fact, the FDA even argues that if you're going to test something on humans, why are you even wasting time on dogs or animals or et cetera, and causing them cruelty? It's a whole nother discussion, but Cytosolve's aim is to eliminate that need, and we've created that technology to do that. But this is really a molecular systems biology approach. So when you look at glucosamine, Cytosolve helps us do a number of things. Look at all the articles on glucosamine, nearly as much as hyaluronic acid. There's about 36,000, or as of right now, 36,275 research articles, and that's over 132 years of medical research, 410 clinical trials. That's a lot of information out there on glucosamine. So if I were to tell you that you got to read all those papers and figure out what they say, and you can't cherry pick the ones you like, you got to go through them. How would you do that? So what happens in science today, people go cherry pick, and if they have a political agenda. But with Cytosolve, we have an approach where we can take those articles, and I'm going to share that with you. We have a very powerful way to take a methodological approach that allows us to organize those articles and then extract out the molecular mechanisms relative to a particular system. Today's system that we're interested in the system today of joint health.
Hi everyone, this is Dr. Shiva. Before we continue with this, I want to just remind everyone that because of the massive censorship and shadow banning that still continues on social media platforms, I'd like you to click the link below to continue watching